Hello, everyone, and welcome. We're just going to give people a couple minutes here to filter into the discussion. All right, so I'd like to welcome you all here today. We're very excited for this discussion on racism and its effect on human health and how the public health field can deal with this problem. I'd like to start with the land acknowledgement. So today we acknowledge that the land on which we are gathered, virtually for most of us that are in Los Angeles, is the home and traditional land belonging to the Tongva Nation. Today, we come with respect and gratitude for the Tongva people who still consider themselves caretakers of this land. It is through their examples that we are reminded of our greater responsibility to take care of Mother Earth and to take care of each other. So today's discussion is going to include 45 minutes of discussion on this topic of racism as a public health issue. During that 45 minutes, you can submit questions using the Q&A function at the bottom of your Zoom screen. You can submit a question through the Q&A function at any time, and in the last 15 minutes, we will answer as many of those questions as we can. So it'll be 45 minutes of discussion, and then 15 minutes of audience Q&A. So I'd like to start by introducing our speakers today. We have a wonderful slate of qualified speakers, or panelists, I should say. First, Dr. Monique Willis is an assistant professor and program coordinator in the Marital and Family Therapy program at CSUDH, where she educates and supervises students working towards licensure in marriage and family therapy. She's a graduate of Loma Linda University with both an MS and PhD in marriage and family therapy, emphasizing medical family therapy. Dr. Willis maintains licensure as a marriage and family therapist and has a small private practice. Her research and practice seek to address socio-cultural issues that impact the overall well-being of individuals, couples, and families. Next is Terry Smith, who is the Director of Sexual Health and HIV Prevention Services at APLA Health and Wellness. He's responsible for overseeing program development, implementation, monitoring, and evaluation of all sexual health and HIV prevention programming, including the organization's PREP Center of Excellence and soon to be open Sexual Health Express Clinic. The diverse prevention portfolio overseen by Mr. Smith includes programs targeting gay, bisexual, MSM from a variety of populations, including crystal meth users, adolescents, African Americans, and Latinos. Mr. Smith has his bachelor's in psychology from the University of Laverne and a master's in public administration from Cal State Northridge. Next, Dr. Archana Moore Sharma. She started her public health career working with underserved populations over 25 years ago. After receiving her BS degree from UC Irvine, she joined the Long Beach Department of Health and Human Services as a health educator providing education for at-risk minority youth, sex workers, and the homeless. These early experiences shaped her perspectives on how social determinants of health disproportionately affect communities of color and create health disparities. As she pursued her doctoral degree at the UCLA School of Public Health, her research focused on the intersections between gender and power among ethnic women in global settings. Since joining the health science faculty at Dominguez Hills in 2011, Dr. Sharma has shown great commitment to serving her students and serves on the Division of Health Sciences Committee on Equity, Inclusion, and Racial Justice. Lastly, Dr. Keelan Lee is an assistant professor of sociology at Dominguez Hills. His primary research focus is on health disparities at the population level. In particular, he's interested in understanding structural and psychosocial factors that contribute to health disparities by race, ethnicity, and nativity status, including the roles of community level, racial, and ethnic context. For example, racial segregation and immigrant enclaves. He's currently working with the Los Angeles County Department of Health to identify multi-level social and environmental risk factors that contribute to cardiovascular disease among local African-American communities. So please help me in welcoming our panelists. All right, so I'm going to start with the first question. Each panelist will have an opportunity to answer. At a time of continued racial violence in the United States and with stark racial health disparities we have seen in regard to COVID-19, how does this current moment compare to how Black and Brown communities have experienced health disparities historically in the US? Who would like to take a stab at this first?
Sure, I'll go, Dr. Roback. In terms of the historical perspective, unfortunately and very sadly, the current COVID-related health disparities that we are seeing are really, they're not new. They're not new for Black and Brown and other communities of color, including, diverse Asian, Native Hawaiian, Pacific Islander communities that have existed in this country since its birth. And it's in that context that we look at the COVID epidemic. We have to have that historical context. And I think that's what brings us today and brings this discussion about the systemic racism, the institutional ways that race, not race itself, because race is socially constructed too, as I'm sure my panelists will address and can talk about, but racism and its manifestations throughout these structures and how they sort of trickle down to a situation like we're facing now, where people of color are dying disproportionately. So, it's a reflection of the past.
Yeah, I definitely agree with Dr. Sharma. And I think what we have seen during the pandemic is really just another replication of many, many historical patterns of health disparities across the racial line in this country. So now it's well known that people of color have higher infection rates of COVID. So what has also been very obvious is the geographic variations across our communities, of course, community of color. So a lot of those spatial inequalities in COVID outcomes align with past evidence, which shows the disadvantages of minority concentrated neighborhoods, which is something I'm very interested in my own research.
I think I agree with Dr. Sharma and Dr. Light in the sense that this is much more of what we've already known to date, right? And so historically speaking, they're correct in that Black and Brown communities have had a long-standing history of experiences with racism and discrimination. And I think what we though see in this particular stance, or in this particular instance, is an accumulation of events that's also been marked by racial violence, political strife, and civil unrest that I think further exemplifies some of the experiences that are specific to communities of color, so Black and brown communities. And so you are seeing disproportionate numbers of people of color impacted by stress, de-stress, racial trauma, and all these things that I think have come to sort of the forefront of what we're experiencing in the midst of this pandemic, in the midst of some of the social unrest that I think is typified of what has historically been the case, but also heightened to another level.
And I would just agree with the previous speakers. I think that it's all been said, and I don't think anyone was surprised when we looked at who was most impacted by COVID. And I think the conditions were there, and it was just, putting like fire to gasoline, however that saying goes. And I do think that for me, I wasn't surprised. And I think back to my work with HIV, for example, right? And in the beginning days of the epidemic, people saw it as a gay white disease, but if you dug deeper, it was impacting Black and brown communities, but that wasn't what the media was telling us. That wasn't the people that you were seeing. And so I just think it's just a reflection of kind of what we have seen happening, and no one who has been paying any attention in this field should be surprised.
Great. So is our current public health infrastructure sufficient to address these racially differentiated health challenges that we are currently dealing with? And what are the biggest barriers to improving this infrastructure in order to make systemic change? Monique, do you want to kick us off?
I sure will. This is a perfect question. And I'll address this answer in particular as it relates to mental health needs, right? And so I think that it has been clear during this pandemic and this time of civil and social unrest that our mental health system has been insufficient to meet the needs of our communities of color. And so Black and brown communities of color have really fared very farly more so than any other group of people in terms of access to proper mental health care. And so in the beginning of the pandemic, there's sort of this rush in particular for Black male therapists. And I will tell you, the experience has been is that the accessibility and the proper training of clinicians in this field has really been poor. And so waiting lists for months on end, or inavailability of therapists that actually had the capacity and the training to treat Black and brown communities were very sparse. And so I think that, do we have the proper infrastructure? No, and it's been clear because in particular in the mental health field, we simply just don't have enough therapists to meet the demand.
And what do you think are the biggest barriers to improving this infrastructure if we want systemic change?
I would say the biggest barriers is having the proper workforce and the proper training for the needed workforce. And so, yes, we could potentially improve the number of students, but then do we have enough schools and programs that are sufficiently trained and have the resources to improve and expand the workforce? And so I think that our biggest barrier is educational institutions that really work to produce clinicians that are trained.
Great. Other thoughts on this from our panelists? Is our current public health infrastructure sufficient to address these challenges?
So yeah, I'd like to add to that a little, building off what Dr. Willis said, that, short answer, absolutely not. Also in public health, we have this chronic problem of being underfunded as a whole in our discipline. It's almost like we're competing with healthcare. And we know that healthcare, even in the United States, has very little federal funding. So within that, public health gets even little. And we're talking, if there's 3-4% of the US budget is dedicated to healthcare, we're getting a fraction of that. And the reality is too, based on what's been happening politically, we get, funding cuts, the CDC has funding cuts, so we have less money put in towards state and county health departments. And so the historically also public health has sort of just been on this decline for not having appropriate funding, when we know that the investment in public health versus healthcare is tremendous. That if we put it more into prevention, then the return on that investment is exponential, right? So I think that that's one big thing, just the overall infrastructure. And again, what Dr. Willis said about the workforce. We know also, not just in public health, that diversity is lacking. We also know in terms of training, for say an undergraduate program for those who are going to be clinicians in healthcare and part of the healthcare system, their diversity is lacking. And we see that those in the outcomes in terms of health outcomes, infant mortality, maternal mortality, just patient-provider relationships. That if you have a provider of the same background, not just having taken a cultural competency class once in their career, but actually someone from their background, that you really see a tremendous impact in terms of their health outcomes.
And I would just add that I think that, first of all, acknowledging that race is a problem, right? And taking concrete steps to address it is something that has to happen. And I think the other thing too is oftentimes in public health, we focus on an issue. So we focus on COVID and we're focused on getting people the vaccine. But if someone's homeless, if someone's hungry, if someone's unemployed, getting COVID, not getting COVID is not going to be a issue or a concern for them. And so I really do think that the current system is oftentimes working in a vacuum, not engaging communities in meaningful ways, not coming to them saying, hey, we noticed this issue, how do we work with you? It's all kind of top down. And so I just think that the system itself has to change and almost kind of begin to really look at racism, view the work that they do through that lens to make improvements in the community.
So I just want to add from a perspective of my discipline as a sociologist. So I think in regard to the infrastructure of public health, it should be a very broad term because it's really connected to so many other infrastructures in our social and public life. So it's not just the medical facilities, right? So from the perspective of social determinants of health, I think that would relate to, say, lower quality of schools, substandard housing, or limited public transportation, and also food desert, which is in a lot of discussion. So I think they all come together, play together, those factors are leading to health disparities here.
And I think Monique addressed this a little bit, so I'll just see if anyone has anything to add about what they see as the biggest barriers to improving this infrastructure.
I'd like to go back to Dr. Sharma's response about the funding piece, right? And so that if there's inadequate funding resources available for mental health, for schools, for subsidies, for housing, for food insecurities, these pieces that greatly affect Black and Brown communities, it becomes one of those things that, irrespective of how many people would want to help and support, that there's just not the means or the mechanisms by which you can actively make change. And I think that funding that's available and earmarked specifically for Black and Brown communities that are readily addressing how discrimination and racism affects them in particular ways that can help ameliorate some of the challenges that are unique to these populations is much needed. So I think that funding piece is sort of like a core mechanism that really needs to be addressed.
And I would just add too that the funding piece is very important, but then also when the services are delivered, how are they being delivered? And I think that really understanding the trauma that has happened in communities, passed on from generations to generations, and the politicalization of public health, unfortunately, I think has done a lot of harm to our communities, and systemic racism systems being put in place, putting a neighborhood, putting a freeway right down the middle of a neighborhood where you're dividing people from services and all of that all has to be addressed. And so we really have to kind of go back to the beginning, to the core of the issues, so that we can really address other issues in the community.
And sorry, one last thing too, Shannon, was that I think also I think Terry, you mentioned this too, that we have to get at the root of this, which is, racism. And that's difficult. That's a difficult conversation to have for us and our society and for all of us, right? So, and from a public health perspective, in the discipline, this has been going on, quietly, and then not so quietly, probably in the last maybe 7 to 10 years or so. And in that conversation that has really come up, the national, our sort of national organization, the American Public Health Association in 2015, really sort of opened this conversation and outlined racism and how our society views it, and says, well, we're pushing, we understand that most of us maybe think of it as this interpersonal relationship or interpersonally mediated, one-on-one. And so you hear people say, well, I'm not racist and racism doesn't exist, but they're interpreting it as, one person versus the other or groups. Then we know that, as you mentioned, there's trauma. So there's internalized racism, right? And then we know what we've had this dialogue about systemic and structural forces. And so I think that part of the barriers also are showing that it's not just the systemic, or maybe we can agree that, yeah, historically some things were we had a racist system, right? And they've impacted today and society, communities of color today, but also that we have that, I think was mentioned, implicit bias, unconscious bias, and we all have them. And so, it's sort of multi-level. I think the barriers we face start from the individual level, and they sort of work their way up through institutions and systems. So, there, again, I'm sure you're going to talk about solutions, but this could be also something where we start to, in order to get to those solutions, we have to see there's multi-levels of these barriers that we face, and starting from just acknowledging white supremacy or, white privilege, and just going an implicit bias and going from there.
Well, that is a great segue into our next question. It's clear that the public health workforce, has a lot of work to do here. There's so much to be done to address these issues. So the next question is, how can the university and academia in general help to create a public health workforce that is capable of tackling the effects of racism on human health?
Well, I guess I can start. I think it's important to recognize the social and the human perspective of health. So that means we should have a core curriculum, that can make sure our students have fundamental understanding of social determinants of health. So I think it's essential because social determinants can really help us understand so many origins and pathways, that lead to racial disparities in health. So racism, that's one of the particular example here. So I think by adding those courses into our curriculum and those trainings, so can really help, us to create that workforce, to really tackle those challenges in public health.
I think this term will come up again. So I'm going to ask, could one of you please define social determinants of health for those attendees that aren't in this field? It's such a fundamental part of public health. And so the panelists, it's very, we use this term a lot, but many of you watching may not know what that means.
Right, that's an excellent point, Sharon. So, so we know there are a lot of factors, right? So that impact our health and well-being. And a lot of things, we think about our biological or, psychosocial factors, whether we exercise or those behavioral factors, right? And our diet. So by looking at social determinants of health, we are looking at those factors at the societal level. For example, race, gender, our education, our income, and our neighborhood environment. So all those like violence that's happening in our neighborhood and so many other factors, or even like at a more broader level, like policy level. So they all interact together that can contribute to our general health status. So I think that's the general definition of social determinants of health.
Thank you so much. So others, how can we, what can we do to create a public health workforce that is capable of tackling this issue?
Well, I think teaching about racism as a public health issue, and really not just teaching about it from kind of like this theory perspective, because the theory is important, but then also people really understanding their own implicit biases and all that other stuff that goes along with that, and having the tough conversations that one has to have to understand how you have privilege, right? And how that privilege has benefited you and how other people don't have that. I think also really framing conversations about social justice, because I think that is part of how we begin to shift change, particularly with young people, of seeing that like this isn't right? And so if we want to adjust society, we need to address this issue. And then I think the other thing that is really important is that oftentimes public health will come into a community and look at the community as victims, and they're going to save these poor victims. And I think we need to work in partnership with community and look at the resiliency in that community and how do we kind of capitalize on those and build those, and so that we can address the issue in the community, because people do care about their communities. They're not just sitting there waiting to be saved, right? But there's just so many other things going on, and no one's really listening to them and engaging them about how we begin to address the challenges in their community.
Terry, I think that gets to a great point about, ultimately what our universities and our institutions need to do in terms of just being self-reflective and determining ways that we sort of also play into racism and discrimination that adversely affects people of color. And so as institutions, I think academic institutions, we need to do self-assessment and really understanding the ways that we serve to maintain some of these issues that we're seeing in our students and education and curriculum, and that ultimately impact the larger community. And so I think that, with that self-reflection, with having that understanding about what we need to do to change those systems that sort of maintain those injustices is one part of the issue that really needs to be addressed. I think the other piece that needs to be addressed is really making sure that universities are being diligent about recruitment and training students, right? And so that it's not only okay to sort of tout the idea that, our schools and our institutions address issues of racism and addresses critical race theory and addresses social justice, but actually being able to recruit students that can actually be of benefit to the workforce, right? And so that what we need to do is making sure that we're being a bit more diligent and a bit more intentional about what we are trying to support our students in learning, and making sure that we're recruiting and being diligent about who we are recruiting. And that needs to come out of the community, and so that it's not to say that our communities don't have these resources. Working with our community is very key to that process, and ensuring that institutions, right, aren't imposing their ideas of what help is on communities of color.
Such a great discussion. Archana, do you have anything to add about training our students?
No, everyone really touched on it. The one thing I know is, I'll speak for, I'll kind of toot our horn in health sciences and in our program, which is a public health program. One track is community health. And so in our program, we train that the fundamentals are social determinants of health. We train students to become advocates. We actually have a class on the health educator as an advocate. And so I think as mentioned, that we're not trying to go and fix communities and solve those problems. We don't want to top down, and that's part of a problem in terms of even othering, where we're saying, well, you guys are different and you need help, and we're not saving them. they have the skills, they have the knowledge and the culture and so much. We're just providing some resources, tools, and support. And I think that that, as everyone mentioned, that really truly is our goal for creating this strong, diverse public health workforce from our students. And so many of them already are engaged in such amazing ways. It's just tapping into them and pulling them into this conversation and these activities.
Wonderful. So I want to remind the attendees that you can submit questions at any time through the Q&A function. And we are going to have our last question now to the panelists, and then it will be completely open to Q&A. But just please submit your questions through the Q&A function. So in the past year, in the past few years, we've really seen social justice organizations increasing their visibility and their work on these issues to the general public. And so what is the role of these social justice organizations in reimagining public health to improve health outcomes for Black and Brown communities? And how can they work with government agencies to produce better outcomes?
So I think that there is a major role. I think that public health really needs to look at how they partner with these organizations, because they have the platform, they have the buy-in from the community, they know the community. And so in my mind, the best partnership is to really work with these organizations in terms of defining the issue, the problem, and then working with them on how best to address that issue in the community. And then identifying people in that community to kind of translate public health speak into normal speak that people talk, so that people understand. And then they're hearing it from people that look like them, that love like them, that they know, and it's gonna be more likely to be received. And so, and then also because the social justice organizations are also focusing on issues that are impacting people's everyday lives. And so it's not just this one thing about COVID or syphilis or whatever, but it's about a bigger issue, be it policing or what have you. I think there's a lot of buy-in that they already have the community. So if they can capitalize on that, I think it's a wonderful a marriage, if you will, of issues.
I agree with Terry. And so when I think about a lot of the social justice organizations, I think that like those are the grassroots organizations that really have a significant understanding and a pulse of the communities, right, that we're talking about. And so they're sort of in the trenches and they really get it. And I think in some ways they've done better at really knowing the needs than us academics do, right? And so like much of our research, much of the things that we do is sort of disconnected because by the time we really understand an issue, it takes so long for us to really get to the heart of what is there. But our social justice grassroots organizations get it. They're in the trenches with the communities of color, Black and Brown communities, and they really understand those needs. And I think that, it would behoove any academic or any other community agencies or government agencies to really hone in on specifically what the knowledge base of these community organizations, right? And so that they understand what the needs are. They have a better sense about how can we better support them in making progress and having a better overall mental health and psychological health and overall health well-being. And so I think that what is needed is a partnership in which we acknowledge some of the information that they can bring to the table and determine ways that we can more effectively meet the needs with their understanding.
Helen Archino, would you like to add something?
No, I think they really covered it. I was thinking about the last question, and then in context what Monique was saying about knowing what the community needs are, and I think to continue with that is taking what the community is telling you. This is what's going on with us. These are our challenges. This is where we're facing barriers to achieve the positive health that we want and that we seek and we deserve. right? And so taking that and then using that to train the institutions and the people who work, so it kind of connects to the infrastructure issue, using that dialogue and that information, and then circling back to saying, okay, this is what is needed. And this is how we train our workforce, our clinicians, our educators, our providers, and childcare providers, everybody. It's not based on what we in the ivory tower, right? What we academics think is the right thing to do, right? But what actually is coming from communities themselves.
And I would just also add something. We talked earlier about funding. And as someone who works for, it's a large FQHC, but has done a lot of work with academic people, oftentimes they get a big grant for something. And they come to you and they want all your information, but they don't want to give you any of their money, right? Or they want to take your participants to study them. But there's no really kind of pathway into attending their university or sparking interest in public health. And so I really do think that it needs to be a true partnership, and not once someone gets the grant, then going to a community saying, hey, I have this to fix your problem, but to maybe do a needs assessment prior to that, and then have that the community be involved in every step of the process so that there's ownership, because I think that's really, really important. So it always comes back down to money and funds and creating opportunities for people in the community as well.
I just want to say I agree with our speakers in terms of the partnership, with community organizations, because as researchers, a lot of us, we don't come from those communities. We don't have that background. We didn't grow up there. So that's why I think a community-based research approach is very important. And I know we have a lot of excellent faculty members on campus who are doing great jobs, great work on community-based research here. So I think it's essential for us to really identify the priorities and the challenges in those communities, and also offer solutions.
All right, so we've got a couple questions here in the Q&A, but I would just like to take a moment and encourage anyone watching the webinar to please submit a question. You have an opportunity here with people who are really knowledgeable about this area, and please use this opportunity to ask some questions. So I'll start with a question from one of our campus librarians. Since our student population is majority minority, how have students responded to social justice and social determinants of health in the curriculum, in the classes that you've taught? Anyone want to tackle that one?
I'll start with that one. So I was really excited. I was a little bit nervous because, these are difficult conversations, and I myself was learning and growing, and so when I first started with this discussion board, and in the discussion board I had short clip videos, and I posted those about different forms of how systemic racism has impacted present day, for us, community health issues, such as, for example, food deserts. So how, nutrition and the ability to have good quality, access to good quality food in Black and Brown and vulnerable, impoverished neighborhoods. They just don't have access. Liquor stores, how many liquor stores are in Black and Brown communities versus other communities, and so many other factors like that. And I was really impressed with my students for taking the time to watch more than what was required, all of them, and to get them thinking. And I will admit that one, I guess, misconception I had was that, maybe not misconception, one assumption I made that was false was that many students, or many of us, know our histories and know what sort of brought us to this place. And I also heard, a colleague say that, that's not always true, that whatever background we are, if we may not know our history, and we shouldn't make that assumption that, oh, if you're African American, you know everything, that's happened, you know what redlining is, for example, or it's not just slavery and today. A lot has gone on, right? And so I think that assumption, for maybe on our part as instructors, is something that was fascinating to me, and got the ball rolling, got the dialogue going with all of my students of color, with myself. It was fantastic. So I know Tessa and I've had fantastic feedback. I incorporated also, this is probably what what Dr. Lee could speak to, is a little bit of mapping. So we looked at where these issues are happening. Where do you see not enough farmers markets, but we expect people to eat healthy? Where do you see, not places where people don't have open spaces to walk and to exercise? Where do you see lots of liquor stores? So we actually can visualize that. And then guess what? You see that they're in a lot of these vulnerable neighborhoods that are populated by people of color. So I think all these little strategies, and I do want to give a shout out to Tessa for helping with those activities. And I have nothing but positive things to say. If any instructors are kind of concerned or wondering how to do it, just start it, go for it, and then keep going with it.
Do others of you have some stories to share about how this material is received by your students?
In the family therapy program in particular, it's been really interesting because our students are in the trenches, right? And so much of their work is within the local community. And it's been much more, I think, important to really address some of the things that they've been going through personally, right? And so much of, I think, the discussion and exploration has been, how have these situations and issues impacted them directly? And then how has that impacted their work and their ability to sort of deliver quality healthcare services to the community? And so we've been spending more time just having conversations and connecting with our students simply about what is it that they're facing in their lives. Many of our students are living in multi-generational households and are affected by so many pieces that I think that maybe other programs or other institutions may not necessarily have to deal with. And so I think it's important to really maybe connect on what are the things that are unique to our students, given that we serve so many students of color.
Kellen, do you have any thoughts on this, your experiences with your students?
So I haven't taught any related courses here on this campus, but from my experiences in other campuses, I think some of them really appreciate this approach or this perspective to look into social determinants of health. And a lot of them can relate to that because every one of us have our own, backgrounds or identities. So I think every one of us can relate to certain factors in social determinants of health. So I think that's where we can approach students in our classes and then try to incorporate our courses and materials, and then to immerse them into this perspective in looking at social determinants.
Okay, great. So we have a lot of good questions coming in, and a couple questions about, what can we do? How can we be involved? I'll save those to the end. We've got a question about college access and a question about policing. So maybe we'll start with this one. I have heard the argument that police or policing is a public health issue. Would you say there is some truth to that?
Absolutely. I can start by offering some evidence. I think that really reminds me of some research on the vulnerable populations, especially those undocumented immigrant population. And a lot of them are harassed by some law enforcement. I think that really poses some health risks, especially mental distress on those undocumented immigrants. And I can also offer a personal story. I heard that from one of my colleagues, and he is a faculty member in another CSU campus. And because of his physical look, he was harassed by the police near campus. So that's like a personal story I've heard about. So absolutely, yes, that's definitely risk factors, especially when it comes to mental distress.
Most definitely. I think that when you look at policing and all the stuff that's going on now, it certainly impacts the mental and emotional well-being of a community. Walking down the street, driving down the street, sitting in your house, you're at risk, and so you're just you're sort of hyper vigilant about all this stuff going on, and so that has to manifest itself in ways that are just not good for the person and for the community. And so I love that idea of thinking about policing as a public health issue, because I think it does impact the mental health, or maybe for me, a better word is the well-being of a person and then the community.
I think both of you made very important points in stating that the mental health stress, right, that's related to policing is very clear. But I think that we also need to make the connection when there's increased stress, how does that also adversely affect our physical health, right? And so that, with increased stress, we're talking about issues of hypertension and increased heart disease and kidney disease. And so it's not in isolation that just because I'm stressed, that's not going to affect my medical well-being. It will. And it has disproportionately affect Black and Brown communities. And so we do need to keep that in mind, that policing is a public health issue. It's a physiological health issue, in addition to it being a mental health issue as well.
And yeah, I'd like to add too that it's also not just the sort of the situation of policing and the immediate effect, but the long-term effect, the consequences that are happening. When we talk about policing, what about incarceration and mass incarceration of our Black and Brown communities, and the impact of that, not just on those who are being incarcerated, but their families. And so we have this exponential impact where it's not just one person going to jail or one group of people going to being imprisoned unfairly because of the policing, right? And those are systemic issues. But the trickle effect, so the physical and mental well-being, as we've discussed, and so many things. I think Dr. Lee mentioned too about education, that public health looks at all these social determinants as public health issues. So education is a public health issue. The judicial system is a public health issue. So when we connect those two, we see, and evidence is there. There's a wealth of evidence to show that communities of color, children, Black and Brown specifically, they're more likely to, get suspended or kicked out of school or drop out of school. And what impact does that have? That is a health issue, because not only for their own health, but then we're talking about social networks and social cohesion, and the impact on those communities is just tremendous. I mean, there's a wealth of evidence. I wish I could talk on forever on that too, but the pipeline, that connection from education and what we're doing to our youth, especially in these communities of color, the limited resources in those communities, and how we're forcing them into certain paths. So I think once they get into those paths, then of course it has a tremendous impact on their well-being. So again, yeah, public health, the way we look at each of these large structures, definitely, racial segregation. I think Dr. Lee works in that with residential, housing, transportation, education, income, job opportunities, the types of jobs. You mentioned undocumented workers. I mean, that links to COVID now, the impact of who was getting COVID, testing sites, so much that kind of comes up from that.
So we've got a couple questions here about education, but before we get to that, what can you say specifically about queer and trans communities of color and the challenges and barriers to accessing public health services for those communities?
So that is a huge issue. I mean, it is the public health system is not really prepared to deal with the community. And many people choose not to access services because they don't want to have to be outed, or they go to a place and they're misgendered, or if they don't look a certain way or act a certain way, depending. It's not a very welcoming space. And so I think, again, more education is needed around this issue. And then you add that being a person of color, stepping into those systems, it's like a double whammy. And so it's very challenging.
Anyone want to add to that? Okay, so I've got a couple questions, like I mentioned, about education. So the first is, do you think that free access to school, so I think we're talking about university, free university access, will that improve structural racism? And this person says, I think cost is a huge barrier to education and self-efficacy in signing up for college. So if we had free college, do you think that would improve structural racism?
I think that alone won't improve structural racism. I think it improves the issue of access. But I think that, again, if the institutions, academia, again, isn't being self-reflective and seeing ways in which they maintain racism and discrimination in the curriculum, in the administration, and sort of how politics play out in the universities, institutions, I think that we would still run into the same issue. So providing services doesn't fix all. I think we just need to make sure that we're addressing those mechanisms that maintain racism and discrimination internally.
Anyone want to add to that? What about, do you think it would be beneficial if there were a high school or college requirement for cultural competency or other classes addressing race and culture? And maybe someone can talk about the ethnic studies requirement that will be added to our curriculum soon. And I guess perhaps if you think something at the high school level could be beneficial as well.
Well, I'm not an educator, so I'll speak on this because it's what people do, right? They give their opinions on whatever. I do think high school's a little late. I would love to see something earlier because I think that when kids are younger, they're just playing with kids, they're just engaging kids. And as they get older, they start having society start feeding stuff into their head. And to someone's point earlier about people really understanding history and teaching unvarnished history, right? And teaching all of that so that people can be able to have a better understanding of communities that are different than them. So I think that's a great idea. I would just, if I was king of the world, you know, starting with kindergarten on up, I would make that happen because I think it's so important. Because I think oftentimes people engage in racist activities because they just have not had information and education.
I just want to say that's a very good question, and it reminds me of the geographic differences, like across different states or areas. Like here in California, in LA, I think it's so diverse, and we think it's natural. But when you think about in some other parts of this country, in like more conservative or rural areas, so those students, maybe they really need this kind of cultural competency requirements because like in their communities, maybe it's so homogeneous, right? So they don't see people of different color. So I think that's why those kind of classes are more important in their school curriculum.
Any other thoughts on adding the ethnic studies requirement that's going to be added? All CSUs will be requiring undergraduate students to take an ethnic studies course before graduating. I believe we're going to start that next year or soon after. Any thoughts on that, or whether, how this could be most effective at any educational level?
I think those requirements really get to the heart of the importance of understanding differences and understanding our intersectionality of identities. I think that having children from early on, and research has shown that children understand the differences very early. So, if we wait to high school, that's probably going to be a bit too late, right? And so that, within the schoolyard of kids playing, they start to understand how that one is different from me. And so if we really work towards ensuring that there is a sense of understanding differences and valuing differences as a human experience, that is really important, and that understanding the history of oppression, and again, it has to be very appropriate for their age and their understanding, right? And so that we're not pushing ideas that sort of would harm children, but I think that it is important from those earlier age. And I think that having the requirement at the university level for all undergraduates is just a small step in the right direction, right? It's a small step in the right direction. It's something that's much needed, especially when you're dealing with the diverse population that we have in our communities. And so how better yet than to make sure that we are exposing our students to better being a part of this community by ensuring that everyone has information that better educates them about being culturally humble and cultural humility, and being responsive to the differences in a very respectful and unbiased way.
Very well said. So I'm going to wrap up with two questions that are very similar. So one is, how can an interracial community that does not have any formal education on environmental health, or how can communities that don't have the information that we have here today, environmental health or public health, how can those communities speak up about specific regulation and policies? And then another student wants to know how personally they can stay involved with these types of issues after they graduate this spring.
So I'll speak to this a little in terms of communities who perhaps, I think this is also part of something to address, is many communities may feel they don't have a voice, or they don't have a platform to share their voice. And so this is also sort of goes to where the communities, and including us in academia, have to do better. We have to do more. We are maybe not reaching those communities. And, we are talking about systemic change, and that includes that voice. So I think while there are some opportunities, we need to really get the ability and the access to sharing your voice. We need to do better, maybe training, like, at least I can speak for in community health field, having community health workers go to homes. We have, even in clinical field, we have patient advocates who, bring people on board and listen. And then those are the places that we have to continue as agencies and in academia to be able to hear those voices, because as mentioned, you have a voice, it's just maybe it's not written out in our fancy language, in our academic text. It needs to be translated into just regular talk. And that those regular conversations are so profound and impactful. And that's so I think, for starters, maybe reaching out to on our end, we have to do better, but from communities is seeing what agencies are open, available, Even I know the LA County Health Department does these town halls and community sessions where they community members are invited. And then on the agency end, maybe do better in terms of having more sessions, having them in multiple languages, having them, once this is all done, maybe in locations that are accessible to community members, in safe spaces, in community centers, in religious institution, in boys and girls clubs, so we can hear all the diverse voices. So, I don't know if that directly says that how can you share? But I think that as a student, also getting involved in activities like this, different committees on campus, and not being afraid to share your voices as a student. We're here because we want to hear that voice. We want to hear you tell us. So I mean, that's a little bit about my perspective.
Anyone have anything to add? Okay, well, I would like to thank the panelists and the attendees so much for being here today. I think this was a fantastic discussion. It is being recorded, so we will make this available to all the attendees and anyone else that would like to view the discussion today as soon as possible. So thank you again to all of our panelists, and the Division of Health Sciences hopes to produce more of these in the future and have more interesting conversations. Thank you all so much.
Thank you.
Thank you.